Okay. All right. Good evening to the Town of Norfolk Board of Health meeting, January 27th, 2022 via Zoom, which we are still allowed to do because of the COVID-19 pandemic. However, there were some extra rules that I think got sent out from Carol Green that we have to take a roll call of the people that are here. So I will start with, I am Eileen Siegel. I am the chairperson for the Board of Health. And please introduce yourselves for the other people who are on the Board of Health.
Andy Bakanowski, Board of Health Clerk.
Carol Dunnington, Board of Health Member.
Thank you very much. Betsy, do you have to introduce yourself at all?
Well, and I am the admin person here, so.
Okay, well, we all seem to be here this evening, so that's great. Okay, I guess we can proceed along with our first order of business, which is the 1 Stacy Road public hearing, request for local upgrade approval, request to allow the soil absorption system to be designed and constructed without a percolation test as allowed by DEP policy. And John Glossa is here to speak with us this evening about that.
Wade is just logging in now too,
Okay.
so. Hey, John, how are you?
I'm good, Betsy. How are you?
Good. I'm good. I'm not 100% sure. I was having trouble with my screen share because I'm not.
Uh-oh. I don't have it on this computer.
I know I'm trying to log into my Google Drive. And
Good evening. Sorry, I'm 2 minutes late, 3 minutes late.
that's
It's
all
all
right.
done. They already voted, Wade.
Yeah, you don't need it anymore, Wade.
I do think, however, you might have to introduce yourself because we are, I guess, required on a Zoom call now. We take a roll call. So I think that you would need to introduce yourself as part of the
Okay,
team.
all right, thank you. Wade Saucier, health agent for the Norfolk Board of Health.
Thank you.
You can go ahead, John. They've seen the plan a couple different times. You can go ahead, John. They've seen the plan a couple different. Sorry, you can go.
I don't know, John. I need to see the plan, John. I don't know.
I can't. I'm trying. I keep opening up Windows and then I keep opening up NCTV or something. So let's just go on.
Okay, I'll explain what it is. So it is 1 Stacy Road. If you were driving from Norfolk towards Millis on Route 115, and sort of before you get to that building, which would be on your right-hand side where they sell some cars and some motorcycles from time to time. Well, just before that on the left is Stacy Road, which is a subdivision, I'm going to guess, of a dozen houses or so. And this house is the one that's on the corner. So as you turned into Stacy Road, it would be on your left-hand side. And Wade and I went out there and we did soil testing. We did not attempt to do a percolation test because this lot is what I term to be manufactured. I believe it was a lot that was somewhat lower in elevation when it was created by God, and then a developer or a builder came along and filled it in. He actually filled it in with some fairly good gravelly material and built a house and a septic system there. The house has been there for a while, I would say from the 70s or maybe the early 80s. And the septic system, has worked up until now, but it failed a Title V inspection. So the client, the owner called me, emailed me, and, we made an arrangement to provide services to redesign a system. So when we went out to do the soil testing, we were able to dig down 146, 140 inches. So, close to 14 feet, right? And we don't hit the soil where we would do the soil testing until we were down well over 7 feet in test pit 1 and well over 8 feet in test pit 2. And water was weeping into these test holes at about 5 feet, so, or even a little less than that, which, makes it impossible to do a perk test at that time. So DEP allows us in circumstances like this to take a sample of the soil, actually one from each of the test pits, bring it to a lab. I used Filch Engineering out of Cranston, Rhode Island. Filch a few years ago, maybe even more now, bought GZA, which is a big engineering and testing firm, but mostly that's what Filch does, is they test materials. So I like to use them. They're very efficient. They do a very good job. They came back and said that these samples were loamy sands. So we apply a 0.66 loading rate in accordance with the DEP policy for a waiver from doing a perk test. We have to sort of translate that into 8 minutes per inch because we're going to use a Presby system, and Presby simply uses perk rates, not necessarily the long-term acceptance rate for the size of their system. So it's based on an 8-minute perk rate, which loamy sand, that's actually probably slower than we would normally get in a loamy sand. We've designed a system. We're going to replace the septic tank with a new 1,500-gallon 2-compartment tank, and then come out to a distribution box where we're providing a leach field that is 7.5 feet wide and 62 feet long. And that's what Presby likes to have, are long systems where the effluent goes into the pipes. They sort of connect together like a snake. So the first 60-foot one fails, and then it will go into the next one, and then the next one, and then the next one, until finally, hopefully 40 years from now, before the system fails. We did, and I'm not so sure Wade saw it or not, but we did look at another area on this lot closer to Rockwood Road, where we did see natural soil, but after looking more closely at the site and at the plan, and I discussed this with Wade, we sort of discounted that area because there's a drain easement there. I went out in the street and did see a drain pipe, and it's a corrugated metal pipe, which, and it's fairly deep in the ground. And that corrugated metal pipe most likely does not have tight joints, so it allows groundwater to leak into it. And that's kind of a no-no. We don't want to put the leach field near that corrugated metal pipe if it's allowing groundwater to leak into it, because we don't want the effluent to have any chance to get into something like that, because then it's going to show up on the surface of the ground wherever that pipe discharges, which is actually down the street, across the street from that building where they sell the motorcycles and cars. So we don't want that at all. So we went back to the original site where the existing system is, where we have about 5 feet or so of gravel over some soil there, and then eventually we get to that loamy sand, and that's where we're going to put the system. So we have the required separation of 2 feet to the groundwater table. We have the required separation, or the required size of the system based on the soil type, loamy sand. And really we have a gravity system, so we're not doing any pumping or anything like that. So I think it's, if you can look at the plan, the system's probably twice the size of the system that was originally put there with that when they constructed the house. So I know you want me to say the words about manifest injustice, but essentially, if we're not allowed to do the perk test, you would probably have to wait until August or so before we could be able to do a perk test here, given the height of the water table. And the other thing, so this woman would not be able to sell her house, and that's what they're trying to do until obviously much later in the year. and it is providing the same amount of environmental protection, in my opinion. It's a type of system which we design, not often, I would say, but from time to time, maybe a quarter of our systems do end up being Presby systems, just because of the trying to fit these systems in with the topography and the conditions on these lots. So I haven't bored you too much. I can answer any questions that you might have about the proposed septic system, the replacement septic system.
Anyone have any specific questions they want to address with Mr. Glossa? Or should we hear from Wade?
Yeah, I have no comments. I mean, it's pretty straightforward, but Wade, if you have anything to add.
Not really. I think John explained it pretty well. I'm just, no, I have the file there, so I feel kind of bad. Do you actually, have you guys seen the plan itself, or?
Yeah.
You did get electronic copy,
an electronic
so this
copy.
isn't blind. Okay, good. Yeah, because you can see, looking at the lot, I'm looking at the plan now, there was limited locations due to deep observation holes. There was wetlands in the back. And as John mentioned, on the left-hand side, there is a 20-foot wide drain easement. So that area is pretty much unusable. Even if they wanted to try it, you still have to have a distance from that conduit pipe. So the choice of the location of the soil absorption system was a good choice. Unfortunately, that lot was had a lot of fill on it to create the lot, which is common in a town for these older lots. You see a lot of developers filling in wetlands and then building homes or making them into residential lots, and this is one of them. And as John mentioned, during the deep observation holes, we did find water at lower elevation, natural soils being lower and groundwater being above it. So it's just physically impossible to do a percolation test. So the sieve analysis is the next step. And the sieve analysis came back, and it's out of sieve analysis, the class ones are actually two long-term acceptance rates. It's dealing with how much sand you have in your sample. And this particular sample had under 85% sand. So it went for the 0.66 gallons per day per square feet. So it's actually the highest of the class two long-term acceptance rate. So it's a very conservative design. Because of the innovative alternative designs and the state's approval, they're allowing this system, because it has enhanced treatment in its leaching facility, they allow 2 feet to groundwater, which is an advantage to the homeowner for not having pump systems, having a mound systems. And this particular one, the engineer was able to make it a gravity-fed system, which will work pretty nice on that piece of property. And I reviewed the plans. Everything looks good, other than this variance, which is required by the local board to recognize this particular laboratory test to take the place of a percolation test. And also, in my peer review, I also mentioned too that there's a deed notification that's required when innovative alternative systems are being used, so that when there's a transfer of property, that the new owner knows that they have an IA system in the ground. This particular one doesn't require any testing. I believe that that requirement for the deed notification was in the earlier IA systems. There were a lot of pumps in it, blowers in it, and where they actually had technicians, and they still do. They have technicians go out there and you look at the blowers, make sure they're working properly, and then even some of them you take samples of the effluent that has to meet certain parameters. But over time, this particular IA system is unique. The Elgin is another one where there is no testing required. As long as it's hydraulically sound, it's fine. So if you have any other questions, if I didn't bore you. Let me help you out.
No. So I think what we have in front of us is to allow the use of a sieve analysis in lieu of the percolation test in accordance with 310 CMR 15.104 and 15.105. So all we have to do at this point is just approve the use of this alternative to the percolation test. and then the application will be complete with the deed notification. Is that correct?
That's correct. That's
All right.
correct. And the deed notifications,
Okay.
it's a standard
Go on.
office procedure, so.
All right, great. So I need to get a motion to accept the alternative to the percolation test, and then the application would be complete with the deed notification.
Eileen, we've got a couple people on the line. I don't know if anyone has any questions that they wanted to ask or have anything they'd like to say.
All right. Lisa or Andrea, are you here to speak about this?
And take that as a no.
Not about this, no.
No,
Okay,
no, not about this. No, thank you.
great. Thank you very much. All right.
I'll make a motion to accept the Sieve Analysis as a means of moving the project forward.
And I second the motion, including that a deed notification is stating the innovative alternate system.
Awesome. All right. All in favor?
Cheryl Dunnington, aye.
Andy Bakunowski, aye.
And Eileen Siegel, aye. All right, so we have passed we approve that the use of the alternative to the percolation test with the deed notification stating that an innovative alternative system is serving the building.
Thank you. Thanks, Wade. Thanks, Betsy, and thanks,
Thank you,
members. of the board.
John.
Good night. See ya. Bye.
Thank you. All right, awesome. Okay, so we have no appointments, is that correct?
We have no appointments.
No appointments. All right, so moving on to our minutes, we are going to review and approve our meeting minutes from December 28th, 2021. I took a look through them and I didn't see anything that I had any corrections at all. So anybody else take a look and feel if they had anything that they wanted to add or change?
I have nothing to add.
Just doing a quick skim through since I just got there.
Sorry, my apologies.
That's okay. Skim away, we will. Take your time.
Wait, did you get some fancy new glasses?
I'm fine.
Thanks for noticing it. These are actually lens that prevents UV lights going into your eyes. So I'm
Oh,
trying it out.
I thought you had like a filter or something like that on
It
your.
is actually, it is a filter, see?
Oh, very nice. Oh, okay.
Yep.
So it's like the blue light glasses. Interesting.
Correct. That is, thank you.
Do they
That's
normally
actually
have
what it is.
that
My
kind of,
sister,
do they normally kind of have that red appearance, or have you tried these
I don't
before?
know. This is the second time I'm using it.
Alright.
So I guess so.
All right.
My sister promoted me to do it, so I checked it out. Checking it out.
Sisters are like that. Yes.
It's pretty cool. And like rosy glasses, you know?
Yeah.
It's nice. There is a difference between flipping it up and putting it down. So I'd recommend to check it out. It's not that expensive.
Interesting. So you can see a difference on the computer screen? I mean, does it look different to
Oh,
you?
yes.
Yeah.
Yes. If you ever use those glasses for night driving.
I was gonna
with
say, it's like
beams
those night
coming
vision, the night vision glasses.
It's exactly like a night vision glasses. Yeah, same effect, the same feeling,
Interesting. All right.
same
I will
cloudiness.
check those out on your recommendation. Wait.
Carol, did we give you enough time to peruse?
I
the-
need plenty of time, so. I have plenty of time. I make a motion to accept the minutes from December 28th.
Second,
All right. The motion is passed with Cheryl Dunnington, Andy Bakunowski, and myself, Eileen Siegel, approving the minutes of December 28th, 2021. Thank you very much. Uh-oh, we seem to have lost Betsy. All right.
I'm here, sorry.
Okay. All right. Our next agenda item is new and old business, and we have some COVID-19 updates. So should we let Ms. Murphy, I'm sorry, there was Lisa Sheldon. I'm sorry, not Ms. Murphy. Lisa Sheldon, she wrote a letter to us regarding our COVID-19 updates from last month's meeting, or I can go ahead with the updates from the school system, whichever you prefer. Lisa, do you feel comfortable speaking at this time, or would you want to wait until after we finish our COVID update?
It's completely up to you. I can wait until you go over the school if you choose.
All right, we can get that out of the way. All right, so we got a letter from Dr. Alardi regarding just reaching out to the Board of Health to let us know that the Massachusetts Department of Education and DPH we're making new COVID-19 testing programs available to districts. The new testing option involves sending home rapid antigen tests with students and staff members who opt to participate in weekly testing. The new testing program was intended to replace the current test and stay option that many districts are currently operating with, and that one provides testing for students who are identified as close contacts of COVID positive individuals in schools. So the new state testing option was based on the following data reported by the DESE. So what they concluded was that the transmission rate was very low. And so based on the available research, they pointed out that test positivity rates for test and stay indicate that individuals identified as close contacts in school are very unlikely to contract or spread COVID-19. Through our local test and stay program, Dr. Alardi suggested that they have only had one close contact out of hundreds of tests administered that tested positive. And in that case, the student was actually exposed outside of school as well. So as a result, Mass Department of Public Health and DESE are recommending districts shift to focusing on only testing symptomatic individuals at school, providing self-administered rapid antigen tests to students and staff who opt to participate in the weekly testing program. This is filled badly, it's kind of repetitive. As a district, the school nurses and administrative team have met to discuss the best direction for our district to move forward, consulted with Janine and Lauren, who are public school nurses, for their medical expertise. And right now, everyone's in agreement that the safest, most prudent route is to adopt the program strongly recommended by both DSE and PH, and shift to optional at-home rapid antigen testing and only symptomatic testing in school. Okay, so they wanted to, she's going to be recommending this new testing program to the school committee on February 9th, with the shift anticipated to begin after February vacation. She wanted to know whether we would like any further information, or have one of us join the next school committee meeting. Anybody have any questions or comments about that? And then there was she also sent us a big memorandum from the state. So if anybody needs a copy of that, we can make that available. Any questions or comments? No? Okay, all right. I don't think that we have to vote on this. I think this is just some information from the school committee. So I don't think we need to take a vote, whether we're not being asked to, say that we are accepting it or not accepting it. They are going ahead with the recommendations from the Department of Public Health.
Yep.
All right.
Okay.
That was all I had to say about that, which was long. And all right, and then our next COVID-19 business was Miss Lisa Sheldon. She had written a letter to the Board of Health with some of her concerns. So Lisa, the floor is yours.
Hello.
Hi.
I actually wasn't expecting to talk today, so I'm not prepared. I was just here to hear your response to my letter. I'm happy to either read it or summarize it or see what you have to say, however you normally handle this.
Well, please feel free to summarize your questions and concerns, and then we can respond to that.
Okay. Well, my biggest concern was Mr. Gilbert's statement and his COVID-19 update, which seemed like an official update to you that he provides at every meeting. And he basically, and I can read it, it's kind of discouraging that that the process has not been able to cope with the new variants or a combination of the new variants, and still 15% or so part of the population that refuses to get vaccinated. And I don't think that kind of language is acceptable right now. It's become really clear that vaccines are not stopping transmission. And this narrative that vaccinated people are dirty, or vaccinated people are the reason for Omicron, or vaccinated people are the reason for the surge in Norfolk is just not true. So I would really like to see this language stopped in this town. It's a national narrative, I know, but the CDC has come out and said, the NIH has come out and said, vaccines do not stop transmission.
No,
So that was my
vaccines
first
actually are used, I apologize. Vaccines they're not going to prevent the disease to happen, but it will decrease hospitalizations. And that's what we're focusing on right now, is the decrease in hospitalizations.
Right, but we talked about this surge in Norfolk, and the numbers are climbing higher and higher. And that was due to these variants and this 15% of the population. The way it was worded is just, I think, inappropriate, because it's not the unvaccinated people who are doing this. It's, Omicron is being spread by everyone. I got it. I'm fully vaccinated. I gave it to my son. People are getting, and I just think we have to be very careful with the language, because I think this language has become really divisive. And I just like to see all residents and their choices respected. So the next point I wanted to make was the conversation on masking. And I just wanted to, I hear what you're all saying, and you've made both your personal decisions, your personal beliefs known, but you've also made decisions as a board, which don't always necessarily reflect your personal decisions. And I respect that, because you're, representing the whole town and you have this wide spectrum of opinions. But I just wanted to give you the alternate view, because in the town, as a parent with young kids, I'm seeing kids at play dates all the time, no masks. At the trampoline parks, they're very crowded. Maybe 80% of the kids are wearing masks, and the 20% who are, more power to them. That's fantastic. But the other people are looking at the data too, saying this data does not warrant me changing my child's life in this manner. We are ready to move on. We have the tools we need. And these are all different opinions. So I just wanted to share that, we're not being selfish. We're not caring about others. No one I know, I'm not sure where your comment came from about people wearing underwear on their faces. I don't know anyone who does that. That would be very odd if I heard someone did that, and I would not agree with that at all. And if you guys have had to deal with that as a board, that's terrible in itself. But there are people who are like me who think this isn't 2020 anymore. We have all these new tools to deal with COVID. No, it's not gone. No, we can still be careful, but we've come very far. People at the gyms right now, the gyms are really crowded. The classes are all full. People want to be out there and want to be healthy. Exercising in a mask is very hard. So people are not just saying, I don't care about you, I'm not going to wear a mask. They're just saying, we have the tools in place. Anyone who wants to wear a high quality mask can wear one and be protected. If I'm going to someone's house and they say, hey, we have someone in our house who's immunocompromised, can you take a rapid before you come over? Absolutely. I think people are willing to and happy to, make other people feel safe. I think the danger of mandates with no off ramps just already puts people on edge. Where are we going? When is this going to end? So I did want to say that I know you might like to have the mandate in place, even if enforcing it wasn't such a problem, but I appreciate you letting the residents of Norfolk make their own opinions. And I do know that COVID is not an easy situation at all. There should always be debate about it. I think the people who always speak with the clearest answers are often the ones who don't know what they're talking about, because it's hard. And there should be a lot of hard conversations to be had about this. So writing that, I just wanted to say thank you for not putting in an indoor mask mandate. It's been hard on everyone. My kids have been doing speech therapy for 2 years in masks. They would be much further along if they haven't. Everyone has sacrificed. In the beginning, everyone needed to sacrifice when we were learning what this was. So I'm not denying that COVID exists. I'm not taking the deaths and hospitalizations into account. It's just my opinion now that we have the tools to do it without universal masking and mandates for all. So I don't know how often you hear from people. So I just wanted to share that alternate perspective with you, just because I think it's important to hear from diverse voices in town.
No, I appreciate it. And we appreciate your letter. This is why we debated whether or not we were going to kind of extend a mask mandate from the municipal and town buildings into, the retail community or the restaurant community. And we elected not to do that because we understand that there are, many diverse views. We get that. And certainly, a business that's run by an individual has that right to say, I would like you to wear a mask in my facility, or I would like you to show me your vaccination card, before you come in. I went to a play in Providence on Saturday night, and they require, showing your vaccine card before you come in. And we wore masks in the theater for the entire time. So, and we decided to go along with that. We wanted to see the play, so having those rules and regulations put in place by, specific organizations is certainly understandable. But, we had some feedback from the town that we were having some issues, with the town employees, and we decided that it would be more appropriate to have the mask mandates specifically for the town buildings and the municipal buildings. So at that time, we decided that, yes, we thought it was pretty much up to everybody else to make their own decision about whether they chose to wear a mask into, a retail store, or whether the retail store owner or restaurant owner would make that choice, and say, this is what we want from our, the people who come into our facilities. We appreciate Mr. Gilbert, the former chair of the Board of Health, making these wonderful charts and looking at all the numbers and stuff. And it's been challenging for us because in Norfolk, having the prison population put into our numbers, and we've contacted the state about that, has made it look quite different from time to time, based on who in the community is getting counted as having COVID. So, we certainly understand your point of view, and we wanted to thank you very much for writing the letter to bring it to our attention, as well as coming to the meeting and speaking about that.
Well, I appreciate you having me on.
Not a problem. Andy or Cheryl, do you have any questions or comments for Ms. Sheldon?
I just actually have one comment. Being a nurse that works in a hospital, we're still seeing a lot of patients coming in. Now, the challenge, or what we're seeing is about 50% of the patients who are coming in aren't coming in with COVID, but they're being tested and they have COVID. So it's everywhere at this point in time. And while Omicron is less virulent than it was before, and I can attest to it because I had it 2 weeks ago. So, and I'm fully vaccinated, and I work in a hospital and I wear a mask all the time. So, that's part of my job. But I think one of the things that we need to say is that it is a balance, that it is challenging for everybody. And I think everyone's getting very fatigued by it. But I think we also still need to be mindful that there are people out there that, have a low immune status and whatnot. And that, I love the fact that you say that if someone asks you to do a test, that's wonderful that you'll do it, that you're mindful that there's some people out there. But I think as a general statement to the public that we still need to be on alert. Hopefully soon it will become like the flu, and that people get it. Although the flu does have a high death rate too, not as high as COVID, but it does have a death rate, that we just are aware of it. And I don't want to have people feeling as though they're going to get angry because people are asking them to wear a mask, or that we're mandating people to wear a mask. I think people should realize that, we want to be helpful to everybody, but not to kind of let our guard down because it's still around.
Sure. And that's a hard balance to find. Let's be helpful to everyone. Let's be mindful to everyone. Let's make sure we're not all in bubbles indefinitely. Right. And I respect that that's hard. There's no easy answer, and there shouldn't be easy answers. And so I think that, rational, polite discussions are always helpful.
Yeah. Good. Well, thank you very much. We really appreciate you coming and speaking with us today.
Thank you.
Thank you. Bye-bye. Right. Or you can stay if you want. Please feel free to stay.
I'll head out. Thank you.
All right. Our next order of business is the Southwood Hospital, 111 Denim Street PIP update. And I think that would likely be Andy Bekanowski's realm.
So on the town website, as well as I think a few other places, the Norfolk Community Page website, there's a meeting on February 3rd at the Zoom. It's a Zoom meeting with the LSP of record, and I believe possibly some of the developing team may be on there as well, or maybe dialing in, but the public involvement plan group will be there, as well as members of the community. I think the last time there was an introductory meeting a little over 10 months ago. I think there were 132 people that had called in, but this will be presenting the draft phase 2 scope of work, which is listed, one of the links that's listed on the town website. You can actually go on and see that. And then there was a recent document that was put on, I believe, 2 days ago, which is the radioactive survey for the filter beds. Unfortunately, it doesn't identify potential sources, whether it's the building or the piping. And then there's also other places that would need investigation, such as the dumping area or the landfill, because having been out there and seeing the biohazard bags there, that's another place that needs to be looked at. But this particular scope of work is limited to the filter beds, where where there were 2 high readings that were detected back in the summer last year. So if anybody's available, they wish to Zoom in, feel free to do so. But it is on the town's website, and there's a few other places as well that you can tune in. So I'll be kind of curious to see what happens with the discussion, because as I mentioned last meeting, the document, the phase 2 scope of work was pretty thin and not a lot of detail. So that's February 3rd.
Okay. All right. Thank you very much. Wade, did you have any questions or comments or anything? Are you familiar with this at all?
Not that last report, no, but I've been on site for a past project that came into town that ended up not continuing. And I've been at the beds, and they were actually, I saw a soil evaluator jump in it. I didn't want to jump in it just because of the history of it, but so I'm kind of familiar with the property itself. I'm just hanging in to listening.
Good. No, good. It's always good. Okay. So finish with our Southwood Hospital update, moving on to our Buckley Man property update, which again, we look to Andy.
Okay. As I mentioned the last meeting, I'm working on a letter. I'm actually taking a little more time to make sure I'm fact checking and double checking some timelines and scenarios. The intent of the letter is simply to notify DEP. It's like, where do we stand with this? The EPA basically finished their work and provided no recommendations or directions to go from there. And as of right now, from the DEP perspective, the site is not in compliance with the mass contingency plan. I mean, it's almost a year they've been out of compliance, and there doesn't appear to be any action. And there's no new let's just say correspondence that's in the DEP files. I checked over the weekend, and I don't think anything came in during the week as well. So so the letter is still in a little bit of work. It's not that long. I just want to make sure my timeline is absolutely correct, because there's so many different sources of information to make sure that things are correct. So that's where I stand with that. So.
All right. Okay. No questions from anybody? Perfect. All right. Moving on to our 2021 annual report, which I think we all kind of took a look at and then made some corrections and updates to. Anything that we need to deal with that? Do we need to make a motion to accept the annual report, Betsy?
Sure. Make a motion to accept the annual report, the 2021 annual report.
A second.
Sorry.
Okay. And the cat agrees as well. So all in favor of accepting our 2021 annual report for the Board of Health? All in favor?
Cheryl Dunnington, aye.
Andy Bakanowski, aye.
And Eileen Siegel, aye. Yay, we have accepted our 2021 annual report. That's great.
Thank you.
All right. So I see our other guest has left us. So I'm not sure why Miss Murphy was here, but she isn't. I was going to ask if she wanted to say anything, but she's not here anymore. All right. So I guess we are moving on to set our meeting schedule. And so the next one is going to be, I love this one, 2/22/22.
It's a
That
good
is
one.
awesome.
Good.
Anybody have any problems with that at this point? My
Nope.
sister's texting me, my husband's texting me. Do they not know I'm in a meeting?
My daughter was FaceTiming, trying to FaceTime me, so.
Hey, I had a catwalk in front of the screen, so.
I love that though. I like Zoom bombing from the cats. All right, well, that works with me too. Okay, so that is good. Is there any unanticipated new business this evening?
I can't think of anything.
All right, no business here. Okay, so on that note, I think we have managed to swiftly come to the end of it. I feel like I always feel like I'm rushing, or I don't know, the meetings always seem to last longer when Tom was the chairperson. Ours are like over in like 45 minutes, which I guess is probably a good thing. Okay, so I guess we can entertain a motion to adjourn at this point if there's no unanticipated new business.
I have nothing.
All right,
I'll make a motion to adjourn the Board of Health meeting at 7:43 PM.
I'll second.
all right, all in favor?
Cheryl,
Aye.
Henderson, aye.
Aye, all right, Eileen Siegel, Andy, and Cheryl.
Andy, aye. Yep.
All right, I guess our meeting is adjourned and we will see you again in about 4 weeks. It's nice to see you, Wade. And I
Nice
will
seeing
look into
you.
those
Nice seeing you
blue
guys.
glasses.
And your rosy glasses.
Yeah, they're nice. Have a good night.
Okay,
You
good
too.
night.
Thank you very much.